Now, obviously, we can't review all of critical care updates in 30 minutes, so we're just going to focus. We're going to focus a little bit on a sort of paradigm shift in our understanding of the pathogenesis of the systemic inflammatory response following injury, and introduce the concept that some of the fever and elevated white blood cell count, and perhaps even the shock that we see in intensive care units is an autoimmune reaction, sterile inflammation, innate immune activation by the host recognizing ourselves, all right? This concept of DAMPs. We're going to talk about problems with recombinant human activated protein C, an update on a trial to try to settle that issue. Does APC work or not? Talk a little bit about the limitations of our current recommendations for early goal-directed resuscitation and problems with looking at the central venous SAT. And finally, at the request of our illustrious organizers, we're going to have an update in mechanical ventilation practices. All right, so here's some key terms in sepsis pathogenesis. Mark Klempner's review in the New England Journal around a clinical pathologic conference is a must-read. Pathogen-associated molecular patterns, we all learned about those in medical school, lipopolysaccharide, flagellin, all these sorts of things that we recognize as foreign. We recognize them when they interact with pattern recognition receptors like toll-like receptors that triggers an activation of the innate immune response. We get SIRS, we get neutrophil infiltration, etc. What's sort of new in our understanding of innate immune activation during critical illness is this concept of DAMPs, or danger-associated molecular patterns. You'll see this referred to as damage-associated molecular patterns. And this is basically parts of us that gets released systemically when we're injured. Intracellular matrix substances such as hyaluronan and other cellular constituents. So I'll show you some data on mitochondria. These are released following trauma, surgery, and we're not quite sure, but possibly when you go down hard in septic shock and develop multiple organ failure, that LFT abnormality, the increase in ALT, showing some hepatic necrosis, that may be a DAMP. That is, hepatic mitochondrial products may actually then amplify the sepsis syndrome. When you're found down with an elevated CPK of 10,000, 20,000, 30,000, the sepsis that goes with that may not be due to an infection, but actually may be an autoimmune reaction to self. And without getting into a detailed discussion about that, let me just show you a cartoon from Calfee and Mathay's review in Nature recently, which basically, after Carl Hauser at the BI Deaconess showed that trauma patients and patients with surgery have mitochondrial products circulating in their blood. And Carl concluded, you know, the fever after surgery is not due to atelectasis? No way. The fever after surgery and SIRS after major surgical procedures is the release of DAMPs, and he focused on mitochondrial products, and mitochondrial products appear to correlate quite well with postoperative SIRS. And what Carolyn and Michael said is mitochondria, which are released after trauma, and surgery derived from bacteria, they contain, as do bacteria, two DAMPs that are recognized by us as foreign: mitochondrial DNA and formulated peptides. So when we get crunched and DNA and mitochondria, either whole or fractured DNA, it's not clear if we need fractured DNA, gain access to the systemic circulation, they bind pattern recognition receptors, and at least in experimental animals cause ARDS. So that atelectasis post-op, that basilar stuff with hypoxemia that may or may not end up putting you back on the ventilator, maybe it's not atelectasis. Carl Hauser would have us believe it's actually acute lung injury, an autoimmune reaction to self. And I just raised this for interested readers to drill down on this a little bit, because this is going to be a major new area for therapeutic targets. Well, some of you may have had a TLR9 antagonist last night. Who drinks gin and tonics? All right, so quinine acts as a TLR9 antagonist. That's one of its mechanisms of action in malaria.